Welcome to our COVID support webinar for the safe use of gyms and leisure facilities. We appreciate that there is a lot of uncertainty and worry at the moment across a number of business sectors. So our focus during the webinar here today is to offer you support and guidance on what is legally required of you now that the government have confirmed the move to step 4 of the government roadmap. We'll be looking at your COVID-19 workplace risk assessment, outbreak management, and to provide you with the information relating to testing sites and vaccinations. We will also be providing you with an FAQ document, a link to this presentation, and our email address to keep to hand, especially if you have any questions to ask of us after viewing this webinar, as we'll be happy to help you. Now, which businesses are now allowed to open under step 4 of the government roadmap? All remaining closed and/or restricted businesses are now permitted to open or fully open their premises, including nightclubs, hostess and sexual entertainment venues, and shisha bars. Although COVID is here with us to stay, and you will see fluctuations of infection rates, hospital admissions, and deaths, Government confirmed that at step 4, most legal restrictions are now lifted. The removal of the following restrictions and changes to guidelines applicable to you are as follows. There will be no need to implement social distancing measures which have previously limited capacity. There will no longer be a mandatory requirement to display the NHS QR code poster, nor to collect customer contact details. Maximum numbers of group bookings, restricted class sizes, individual or household exercise is now being removed, and all spectators are now permitted to attend site. The government have requested and advised that there must be a gradual approach to the easing of restrictions, and for people to take a responsible approach to lifting certain control measures within your venue. Your risk assessment will identify appropriate mitigations which are appropriate to adopt, and you will find as we move on that many mitigations will in fact remain. With time, it is expected that you will take fewer precautions to manage the risks of COVID-19. Now, legal requirements and restrictions that remain. There are restrictions and legal duties that still remain, all of which will assist with the protection and keeping of yourself, your staff, and others who visit site, and will of course help to prevent the spread of the virus between others. Self-isolation remains a legal requirement, and your duties under health and safety law to protect workers and others from workplace hazards. This is the same with other workplace hazards where you are required to risk assess and to implement adequate control measures to manage that risk. Now, there are 6 priority actions to protect yourself, your staff, and your customers during coronavirus. Number 1, to undertake a risk assessment. 2, provide adequate ventilation. 3, for you to clean more often. 4, to turn away people with COVID-19 symptoms. 5, to enable people to check into your venue. And 6, to communicate and train. These 6 priority actions are to make your premises a safer working environment and a safer place for people to visit. This guidance applies to the following: to gyms, swimming facilities, personal trainers, those of you offering outdoor classes, and premises such as hotels with gym and leisure facilities on site. Now, what is a risk assessment? Broadly speaking, a risk assessment is a careful examination of what, in your work, could cause harm to people and the ways that you can successfully manage these risks to avoid this harm from occurring. As the responsible person, you must conduct a risk assessment to understand how the virus could be transmitted in your premises. You should think about the way that you conduct your work, how your premises is used, and ways that you can protect yourself and members of the public by identifying factors that could result in transmission of the virus. By identifying these hazards, you can then identify sensible measures to control these risks. An example of a hazard would be touch points such as door handles, taps, cash, and inadequate ventilation to enclosed spaces. These touch points create a risk as the virus could be present on these surfaces. To avoid this risk, touch points should be wiped down frequently, including gym equipment and free weights, and contactless payments, including online bookings and membership payments, should be encouraged. Staff and volunteers should be trained on the findings of your risk assessments. They should be reviewed and amended as required. Where there are 5 or more employees, please remember that you are required legally to document your findings. Now, to assist with the NHS Test and Trace service, you are encouraged to continue to display the NHS QR code poster for your customers to use at their discretion. Please remember to display this in a prominent position at the front door or reception desk. Every customer or visitor aged 16 and over is encouraged to check into your venue or to leave their contact details with you. Many of you will already have a booking system where you record individual details, for example, group sessions, and these should be kept securely for a minimum of 21 days to assist the Test and Trace team. You must also assist the Test and Trace team by keeping a temporary record of your staff shift patterns for 21 days and assist the team with a request for this data if needed. This could help to contain clusters or outbreaks. Please remember to request that all visitors also check in with or leave their details with you, including your local environmental health officer, pest control, and any engineers that attend site. In the case of an outbreak, your records may be requested from the NHS Test and Trace team relating to specific times and dates. You should assist them as best as you can and provide them with your logbook of customers to assist in tracing those affected. Your venue details will remain confidential during this process. To continue to reduce the risk of spreading COVID-19 when visiting your premises or accessing your services, we request that you continue to incorporate the following. By allowing people to continue to distance themselves from others, think about your capacity and a gradual approach with the keeping of side-to-side machines. Think about capacities to saunas, jacuzzis and steam rooms, and that swimming sessions are managed well. Continue to request that those with symptoms do not attend site, and ensure that where you have made changes to entrances and queues, that you have considered those customers who are disabled. Continue to use screens or barriers to reception areas, or side-to-side or back-to-back working. Remember to use fixed teams or partnering to reduce exposure to others, and continue to utilise online and outdoor sessions. Now, face coverings and PPE. Where you are already using PPE in your work activity to protect against non-COVID-19 risks, you should continue to do so. Any use of PPE should be determined by an assessment of risks in the workplace. Workplaces should not encourage the precautionary use of extra PPE to protect against COVID-19 outside of clinical settings, or when responding to a suspected or confirmed case of COVID-19. Unless you are in a situation where the risk of COVID-19 transmission is very high, your risk assessment should reflect the fact that the role of PPE in providing additional protection is in fact extremely limited. However, if your risk assessment does show that PPE is required, then you must provide this free of charge to workers who need it. It must also fit properly. Now, as you are aware, it was not previously a legal requirement for staff and customers to wear a face covering within your venue, although many of you did encourage this as a precautionary measure. People are now being asked to take a sensible and responsible approach to this. We strongly advise that at this time that you continue to ask your members and others using your facilities to wear a face covering just before they enter and as they access toilets and as they leave. You need to consider the reasonable adjustments needed for staff and members of the public with disabilities. You need to consider carefully how this fits with other obligations to workers and the public arising from the law on employment rights, health and safety, and equality legislation. Some people are not able to wear a face covering, and the reason for this may not be visible to others. Please be mindful and respectful of such circumstances. Be aware that face coverings may make it harder to communicate with people. For those of who rely on lip reading, facial expressions, and clear sound. If your worker do choose to wear a face covering, you should support them in doing so. And this also means by telling them to do the following. For them to wash their hands thoroughly with soap and water for 20 seconds, or to use hand sanitizer before putting a face covering on, and before and after removing it. When wearing a face covering, workers should avoid touching their face or face covering, as they could contaminate them with germs from their hands. They should change their face covering when it becomes damp or if they've touched it. They should continue to wash their hands regularly. They should change or wash their face covering daily. And if the material is washable, for them to wash in line with the manufacturer's instructions. And if it is not washable, to dispose of it carefully into the usual waste stream. Now, keeping your premises clean. COVID is carried in the air through tiny droplets. Larger droplets can land on surfaces that they touch, while smaller droplets, called aerosols, can stay in the air for at least 5 minutes if there is no ventilation. Therefore, cleaning your premises is a crucial part to achieving compliance and controlling the spread of the virus. You should implement a strict cleaning regime, focusing on touch points such as door handles, taps on all hand wash basins, toilets, shared facilities, gym equipment, card machines, and any access screens. We strongly recommend that you have a designated team member or members who take sole responsibility for these tasks, and that frequency is high, especially during busier periods. Every 2 hours during peak times is advised, with a checklist as a reminder. You should continue to use your normal cleaning products that you have been using. However, there is a British standard product available, referred to as BSEN 14476, that is recommended, but it is not compulsory. It is only compulsory when you are reacting to an outbreak of COVID-19. The guidance stipulates that you should carry on with your normal everyday disinfectant and sanitizer. Consider having in place cleaning stations for customers to use to clean after using equipment, ensuring that these are stocked, using inductions to request customers to clean equipment after they use it and place signage throughout the premises. Please ensure that you have adequate waste provisions for cleaning materials, with plenty of bins around the premises for customers and staff to use. Hand washing remains a key control measure to help to prevent the spread of the virus. You should ensure that you have designated hand wash basins located in convenient locations, with a supply of hot and cold running water, liquid soap, and paper towels for hand drying. Hand sanitising stations should be placed at the entrance, toilets, and other areas throughout the premises. Staff should be actively encouraged to wash their hands as often as possible and for a minimum of 20 seconds. They should also be reminded to wash their hands after taking deliveries and after handling merchandise. Now, ventilation. Good ventilation brings fresh or clean air into the indoor spaces. The more fresh air that is brought inside, the more diluted any airborne virus will become. In poorly ventilated spaces, residual virus can remain in the air after an infected person has left and increase the risk of COVID-19 spreading. Many of your premises will be quite large in size, but you may have smaller spaces or rooms that are used by others which are small in nature and less ventilated. Areas, as an example, could be spinning spaces or studios used for hot yoga. You should maximise the supply of fresh air in your premises and to these areas, and you can do this via the following: fully or partially opening windows, air vents and doors to improve natural ventilation. If you use mechanical ventilation, ensuring that your systems are set to maximise fresh air and minimise air recirculation. Maximising the amount of fresh air your system draws in, or ensuring additional fresh air will help avoid COVID-19 from spreading. Identifying any poorly ventilated spaces as part of your risk assessment and taking steps to improve fresh airflow in these areas. You should prioritise these areas for improvement to reduce the risk of aerosol transmission. The HSE provides guidance on how to identify poorly ventilated space. It also explains the steps that you can take to improve ventilation in these areas. Now, if you can't improve ventilation within these poorly ventilated spaces, you should consider whether it's safer to restrict the time spent in these areas and the number of people that access these areas or spaces, or stop them from using them for the time being. Our Trade with Confidence page contains important information regarding the use of CO2 monitors and how CO2 monitors can help to identify poorly ventilated areas. Please take a look at this section on our website for more information. However, just for reference, where there is a continuous talking or high levels of physical activity, such as dancing or playing sport or exercising, as mentioned, hot yoga or spinning, providing ventilation sufficient to keep CO2 levels below 800 parts per million is recommended. Now, LFT testing should take place twice weekly. Those who present with symptoms or test positive following an LFT test should isolate and arrange for a PCR test. When do my staff need to isolate? If they are symptomatic, and this applies to the vaccinated and unvaccinated persons. If positive via an LFT test and whilst waiting for a PCR test, again for the vaccinated and unvaccinated. If they receive a PCR test which is positive, again for the vaccinated and unvaccinated. When in close contact with a positive case, when returning from amber countries, and when returning from red countries which currently require quarantine. You have legal responsibilities to ensure compliance and must not encourage nor ask someone to work whilst they are required to self-isolate. You as the employer and your employee will be liable for legal action in the form of a fixed penalty notice and/or prosecution breaches. Fixed penalty notices at the moment range from £1,000 up to £10,000. There are some proposed changes coming, and the government are set to announce what these confirmed changes are. Please do keep an eye on the news and our dedicated COVID-19 business page for further details. Now, what is an outbreak? An outbreak is a sudden increase in occurrences of a disease within a location through person-to-person contact or from the environment. If you become aware of 2 or more positive cases of COVID-19 over a 14-day period within your workplace, you should contact Public Health England on telephone number 0344 225 3560, followed by option 0 and option 2. You should have a lead contact within the business to control and manage these incidents. The lead person should immediately identify any close workplace contacts and advise them to self-isolate. You should not wait for the NHS test and trace team. This prompt action will help to reduce the risk of a workplace outbreak. If the local public health protection team declares an outbreak, you will be asked to record details of staff with symptoms of COVID-19 and assist with identifying any close contacts. You should therefore ensure that all employment records are up to date, and you'll be provided with information how the outbreak management process follows. This will help you to implement control measures, assist with communications to staff, and reinforce prevention messages. Should you fail to get through to the Public Health England team, please contact our local public health team on the email address provided at the end, where they will be happy to help you. Please contact Environmental Health COVID Compliance Team for support and advice in relation to workplace enhanced cleaning and for any additional support. We'll provide you with the guidance to clean in the workplace for non-clinical settings where there is a suspected or confirmed outbreak. Now, one thing to remember to continue to implement during such uncertain times is to continue with designated teams and partnering to reduce exposure to others, which will also assist with being able to remain open during instances of workplace outbreaks. Now, other areas for you to consider. There are some groups who are at higher risk of severe illness from COVID-19. Please see the guidance on who is at higher risk and protecting people who are clinically extremely vulnerable. You should give extra consideration to people at higher risk and to workers facing mental and physical health difficulties. Those who are clinically extremely vulnerable are no longer advised to shield. You should continue to support these workers and your clients by discussing with them their individual needs and supporting them in taking any additional precautions advised by their clinicians. Consider providing support for workers around mental health and wellbeing, and we will provide you with a link for further advice on this via our FAQ document. As an employer, you have a particular responsibility towards disabled workers and new mothers or those who are pregnant. Please carry out an individual risk assessment to assess their needs. Remember to include breakout and rest rooms for staff in your cleaning areas and any restrictions that you deem suitable, such as limited capacity, ventilation and cleaning supplies for staff to clean down these touch points in between uses, such as kettles and microwaves. Don't forget to include spectators into your risk assessment, requesting that they check into your venue via the NHS QR code poster or to leave their contact details with you. Request that they use hand sanitising stations and that they wear a face covering as they enter and move around the building until seated. When visiting people's homes, for example for PT sessions, please ensure that you are carrying out a pre-health check of all household individuals for symptoms of COVID-19, any self-isolation requirements, and also to see if there are any vulnerable household members. Please bear in mind that there may be requests for face coverings to be worn by individuals, and it is still a gradual approach to social distancing where you should still remain extra vigilant when it comes to physical distancing from others. Meetings and trainings should be encouraged to be via alternative means still, and any work-related travel should ideally be done alone. If car sharing takes place, people should be advised to wear a face covering, and also when using public transport. The City Council has introduced a COVID compliant grant. This is available to all business sectors, including charities, the voluntary sector, the self-employed, including yourselves, to recognise your hard work and to help you with means of operating safely, such as funds for hand sanitiser, cleaning supplies, posters, and even contribution towards ventilation. We've received over 220 applications so far, and urge those of you who haven't yet applied to please do so. There are limited funds available, and it is on a first come, first served basis. We will provide you with details as to how to apply via our FAQ document afterwards. Businesses with 5 or less employees are entitled to £500 and 6 or more £1,000. Once the application has been submitted and accepted by our grants department, an officer within the COVID compliance team will make contact with you to arrange an appointment to visit you. During this visit, the officer will go through your COVID-19 risk assessment and assess your control measures. They will also offer you any support or guidance where needed. You will be issued with a COVID compliance sticker, and your business details will be listed on the council website as a COVID secure premises. Now, testing and vaccinations. The following few slides show vaccine and testing information, walk-in centres, locations, and test sites for symptomatic and asymptomatic testing. Please encourage the workforce to receive their vaccination to protect both themselves and others. Please make contact with us should you have any questions or concerns, and we will be happy to help you. There is some information on guidance documents and useful information. We thank you for your time and for listening, and we wish you all the best for the next stage of the government roadmap. Please remember to be safe and most of all, to be kind to one another.